So thanks everyone for joining. This is Women Who Futures, an event organized by Abril and I, and we are very happy to have you here. This session, as I said, is part of this bigger event where our intention is really to create safe spaces for us to talk, to engage, to exchange and promote and celebrate the work of women in futures and foresight. We want to showcase a diversity of approaches that women are taking in this field. We want to reflect on how much our intersectional identities inform our practices, and also how can we articulate gender issues and feminist principles in the work of Futures and Foresight. We have an amazing lineup of speakers, as I said, so please take a look at the program and join as many sessions as you can. Most of the sessions will be recorded, so if you cannot make it to all of them, you'll be able to watch it later in our LinkedIn page. And when you participate in this event, you necessarily agree to our code of conduct that I'm going to put in a minute in the chat, because our intention is for this to be really a safe space for all of us. We have a zero tolerance policy on any form of harassment and discrimination. And of course, we're going to have many different opinions, and they are all very welcome here. So I will hand it over to Tiana and Sonia. Welcome, and the floor is yours.
Great. Thank you. Hi, Sonia. Hi, everybody. Also, I just wanted to give a big round of applause to you as well, silent or otherwise, to Thais and Abril for pulling this together. It's a lot of work, and I think you've been working morning, noon, and night to pull this off. So thank you very much for doing that. Well, you've seen our bios. I think that explains us. I'm going to start sharing my screen because we have a bit of a presentation. We'll kind of go through what we intend to do here. Just as maybe a little bit of a warm up, make sure everybody's little electronic hands are working. We can do a show of hands type of thing for if you drove into work today, can you raise your electronic hand? Can you do your reaction? If you walked into work today, took the bus, took a helicopter, took an Uber. We just want to make sure that everybody's hands are working because we just have a couple of questions for people when we start. So we're only together for an hour. Hang on a sec. Sonia, you do some talking while I sort this thing out.
Okay, great. Well, it's nice to see some familiar names and a lot of new people as well. What we're going to do is familiarize you a little bit with the very specific sector that we work in, which is around animal health, and then have a few kind of thought experiments to explore with you, which will be related to results that we'll be presenting, but will hopefully also be of interest to your wider reflections and engagements in whatever sector you're involved in. So Tiana is going to talk us through a little bit about the background of... Hey, stop. Oh, sorry, if people could turn
Somebody's
off
parenting.
Yeah. Children are welcome as our pets to follow the session. Yeah, so Tiana will take us through an overview of what we mean by animal health in this context. And then we'll look at some studies we've done related to gender, and then we'll take you into an interactive exercise.
Great, thanks, Sonia. Thanks, Sonia. And click. There we go. There we go. So as Sonia said, what we want to do here is kind of think through some things that what we have a tendency to do in a lot of policy environments is go, we have a problem and there's a solution, and it's a direct line from A to B. But there is a whole system that we're operating in. There's all kinds of things going on that we haven't taken into account. So getting to A to B might be a little bit difficult. So the next thing we want to talk about too is just who we are. Does anybody know who we are? If you can just raise your hand if you do. I might see it.
When you
Okay,
say
I
we,
don't know.
do you mean the World
WOA,
Organization
sorry,
for Animal
WOA,
Health?
the World
Yeah.
Organization for Animal Health. I don't mean to look at myself as an organization or. So a few people do know who WOA is. So you might be familiar with what our mission is about. We are talking about the management of health, animal health information. So we're expecting our members, the member countries of the 183, to be reporting on their animal health status, what diseases are present in their countries, whether they're there over time as endemic, or if they're popping up for the first time. And we share that information around the world so that other countries know what's going on. There's standards as well. So the standards are around monitor to reduce or in some cases prevent the transmission of animal diseases through the trade of animals and animal products. There is a capacity building element that we do as well that's related both to our standards and to the transparency piece, and also around global initiatives. So there are some things that we talk about, like with One Health, this idea of taking an approach to any health issues from a lens of the animal, human, and environment perspective. So that's just us in the WOA in a nutshell. You probably saw the 100 in the corner there. We're celebrating we just turned 100 years old, if you can believe it, this January. So when we talk about animals and those people here today who know what we do as an organization, for those who don't, what kind of animals do you think we're talking about? If you can just write it in the chat, or you can open your mic, or whatever you like.
Maybe about livestock?
Yeah. So livestock, exactly, like not so, we are, yeah, anything to do with livestock. So livestock and poultry, but also aquatic animals. They could be amphibians if they're wild and running free, if they're farmed. Even bees, we have standards around infectious disease of bees. So we have a wide range of topics that we touch on in the organization. So that's us in a nutshell. I just wanted to talk about foresight and really about anybody who works in a technical type of environment, whether it's health or animal health or public health or environmental health or whatever. We have a lot of tools that help us perceive the world, make sense of it, also try to forecast and predict a little bit and test out what we're trying to do. So those are quite familiar to us in terms of effectiveness assessments, even simulation exercises when we're looking at emergency management, how to deal with animal diseases in an emergency management type of situation. We also have a lot of risk assessments when we're looking at what pathogens might do, where it might go. Are we going to be importing something or not because of the potential risks of spread of disease, etc. And surveillance, epi-intelligence, and early warning, that's part of our toolkit in the work that we do, as well as monitoring. And a lot of this goes, we look at the past, we look at the present, we can maybe stretch things out a little bit with risk assessments, a couple of months out. Even with the forecasting, like disease modeling, we can probably stretch things out a couple of months and have an idea of where this might go, where an infectious disease might go. Foresight, on the other hand, stretches out timeframes, right? It kind of opens up where we could possibly see animal health, infectious disease, etc., how we interact with that in a much broader time frame. So stretching it out, looking at the past, present, but really stretching our minds out to several years down the road. I have worked with people who work in animal health and use foresight, and they use it for a couple of months, or they use it for a couple of years at a time. But with foresight as well, we're trying to take in other factors that we don't have in our risk assessments, like the societal, technological, economic, environmental, political type of elements that are also influencing our decisions, and also could influence how disease is spread. So that's another way of adding to our toolkit from a technical perspective. And again, we can all use this. We use all of these tools in terms of strategy, preparedness, prevention, disease outbreak response, control, and part of our scientific advice. For WOA, we're just at the beginning. We're just scratching the surface on the use of foresight and where we can go with it. We're very much in discovery mode. However, we have used it for creating spaces for reflection, just sort of sitting back and going, okay, we don't have to make any decisions today. Let's reflect on what the implications and consequences of a certain topic might be. Where can we go with this? We've done everything from futures wheels for COVID in livestock, to how are our operations going to be impacted when there are political tensions and things like this. And we've been able to kind of ready ourselves, but also just start thinking about what connections we need to make, just thanks to something as simple as looking at impacts. Like, what's the first order impact of COVID in livestock? What's the second order? What will happen on the social level, technical level, political level? And we can kind of break it down from there. We haven't gotten necessarily into where we can go with foresight around strategy, either formulation or strategy testing, etc. But that will come. And I'll hand it over to Sonia now, just to talk about where we're at with gender and how all this is related.
Thank you, Tiana. And for those who've been on Zoom all day, following fascinating conversations on futures, I invite you to take a moment to stretch and look outside as well while we go on the next bit. So why are we talking about gender here? Well, about 4 to 5 years ago, a group of internal staff at the World Organization for Animal Health realized that gender wasn't anywhere. So it was really absent. It was absent from our texts. It was absent from our programs. It was absent from our collective consciousness. So an internal working group of staff was set up to create a kind of network internally and to start WOA's journey to becoming gender aware. And so that group gave itself the role of mapping data, context, needs, identifying opportunities to get started, building awareness and skills internally in the organization, which then allowed us to start working with some of our more external stakeholders, which are so we call them member countries. So as we're an organization that has 183 member countries, and that showed us that actually a lot of our members are far more advanced than we are, because they're operating in the complex system of national government, and many of them have gender strategies or have identified how gender matters to them in animal health work. So that was really important for us. And our next steps will be to start putting this into a strategic framework. So this pool of internal staff's role to really initiate, motivate, coordinate, set up, support, build, multiple avenues for how gender can start becoming visible in our work. Thanks, Tiana. And so as we start thinking about where we want to go with some of the data that we've got, we'd like to invite you to go on this journey with us. I'll present just a few findings from recent studies, and then we will unpack them together and think about what they might mean. So in Southeast Asia, we had a study undertaken in 2015 and then another one in 2023. So we can see some trends here. One of them is the numbers of women in the veterinary services. So in 2015, there wasn't really a clear sense of whether that was steady, growing. 30 to 50% of the veterinary workforce in most countries were women, except for Malaysia. And particularly in the public sector and in private clinics, not so much the case in private farms. By 2023, 60 to 70% of the workforce were women, particularly in the 4 countries listed here: Brunei, Malaysia, Myanmar, and Singapore. And in other countries, it was still reaching about parity: Thailand, Indonesia, and other countries with about a third: Cambodia, Laos, Vietnam, and some a bit less. So we think it's fair to say that there is a feminization, especially when we look at numbers of students, which are very high in terms of the number of women students in veterinary, particularly for veterinarians and also for veterinary paraprofessionals. Next. The study showed us that there's a stereotype that farm work is not for women, with a lot of people reporting that they are told that women don't go or are not so suitable for farm work, especially when they're students. And yet we see that 65% of women students are considering or likely to apply for a role in a farm. So this shows us that the sort of cultural stereotypes and then the actual intentions of individuals are not aligned at present. Next. Almost half of the people interviewed in the survey were not aware of any kind of gender policy of their institution, which could be a veterinary education establishment or an employer. But we see that about a quarter of them were aware, and others were just not aware of whether there was a policy or not. But most respondents said that it would be useful or valuable to have a policy on gender. And we're mentioning this for a few reasons. One, because when we talk about systemic change, we often talk about policies and legislation, and this is often cited as one of the key steps for reaching change, be it on gender or in other areas. So it's something that we might want to query and think about. Thanks. So we did also concurrently a smaller study in, So first, in terms of our conclusions. So like I said, we can see feminization of the workforce. Other elements of the study showed us that women do access more high-level positions, but there is a glass ceiling still. And that young women professionals are the most vulnerable to discrimination. And as we said, that women are discouraged from working on farms. So the resulting recommendations from this analysis were that we should integrate gender considerations into national workforce assessment and planning. So think about career progression, for example, for women and what would enable that, linked to family-oriented policies and facilities. We should offer mentorship for early career professionals, address gender stereotyping, including within veterinary education, where a lot of ideas are formulated or get stuck, and provide more hands-on experience for women. So I'd like you to just sit with those because we'll come back to them in a different format in our group work. Now, in West Africa, we did a smaller study in 2 countries, and I'll just highlight a few of the results there. We saw that there's limited information on gender in the veterinary services in general in Africa. So that means that those who are developing research or publishing are not talking about gender in veterinary services per se, although there is a lot of focus on gender in agriculture more widely. Veterinary services are sometimes considered sort of the pauper in the system. You know, public health receives more funding than veterinary services, for example. So it's interesting to think about that as well. What we do know is that there is national regulation and policy. You can stay on that one, Tiana, in a number of countries, including Senegal and Togo. And of course, many of these countries have signed up to international treaties or agreements on gender. And that women are more likely to work in public sector and in urban areas. And that correlates with what we saw in Asia as well. Next slide. Some specific data from Togo, where there's 191 vets and veterinary paraprofessionals in the country, shows that 7% of the vets are women, with 2 women who are private vets, and 20% of veterinary paraprofessionals being women. So we don't see here whether there's really a trend, but we see that they're definitely a minority in terms of the workforce. And that numerous barriers exist, including perceptions and self-confidence, the sense that somebody could apply for this kind of role. Lack of financial support and unsuitable accommodation or other conditions that make the long studies that they have to undertake quite precarious. A lack of opportunities to gain practical experience, such as practical internships being offered firstly to men, and a lack of role models in the sector. And this is cited very often as being very important. And also, it's often cited that WOA, where we have at the moment a female Director General and a lot of women staff, is often seen as an inspiration to veterinarians around the world, where their own workforce doesn't reflect that kind of parity. Next. All right, well, I'll close in just a minute. So recommendations from this report told us that we should do gender audits of the livestock sector and vet services, that it's very important to have gender policies in place for education establishments, as well as for veterinary services, including on sexual harassment. An issue that I've never really seen come up, sexual harassment, in any of the sort of standards or policies related to international governance on vet services. Improving visibility of women in the veterinary sector, increasing the proportion of female educators, improving conditions for female students, and developing leadership training for women students and professionals. So both in terms of building confidence, building their skills, their understanding of leadership, their negotiation opportunities, and so on. So here are the recommendations again. I'll invite you to just sit with them for a moment. And what we're going to do now is hand over to Tiana. I wanted to just share one more days to set, which is from another study conducted by Vizo et al., who I think is attending today. You could just take me to the next map. So I think we're having some problem with our slides. So this study was recently published. So there's other data out there on leadership in veterinary education, and this is an updated review of what's available. And we see here a map that shows us the proportion of inferred women executives in veterinary education. So in terms of veterinary education establishments, where are there women who are in the executive leadership teams? So the dark red is 0. As you get into the sort of lighter red, that becomes about halfway to white. And then where we get into blues and purples is over 50%. So it's interesting to see the regional variations here. If you look at sort of the Middle East and South Asia, and then if you go into Southeast Asia, you see it like we were saying, so more women in the vet services, and then we see that represented in leadership as well. And then the blue areas, some of them ex-Soviet, some of them Northern Scandinavia, a bit of Southern Africa, and then a very little bit in the Americas in terms of being blue, so over 50%. So some interesting indications. And the study also showed us that higher proportion of women was also aligned with other data, sort of other indices on advancements in gender equality. So now that we've seen some of this data and got a sense of some of the trends, let's think about what we do with that. And Tiana's going to help us think through that.
Right. So thanks for that, Sonia. And of course, if you have any questions about any of this, please do write to us in the chat. And as I said at the beginning, we were thinking about, how we usually react of like, oh, there's a problem, here's a solution, and we just go from A to B. And as the organization is, going from this journey of gender blindness to gender awareness, and we have these recommendations, coming to us from the studies that have been supported and by WOA and and with the financial support of donors to WOA for this type of work, we look at the recommendations and we kind of think to ourselves, okay, this seems perfectly reasonable. And it seems like this looks like something that is desirable, like we can talk about it in a future sense as a desirable future, or it's going to be a solution to, a quote unquote problem. So we wanted to just explore that a little bit with you to look at, if these things like quotas for leadership and teaching positions, or there's designing veterinary services for women users from a lot, in livestock, poultry, and food safety, and women are more visible in, making women more visible in veterinary sector work, what would be the requirements for that? And also, what would be the consequences of that? What would, kind of happen? We try to unpack these types of things so that we might be blind, but we're starting to see, and maybe we need to look at these things a little bit closer. And that's part of our sort of awareness, if you will, just not going from, we have a set of solutions here, let's just implement, when we know that there's all other types of things happening in the world that could impact and influence it. So I didn't do, even though I'm a foresight practitioner, I didn't do anything fancy. I just thought that, well, none of the foresight tools are that fancy, but they're all accessible. I just thought, we look at it from a mind map type of perspective. So I'll stop sharing my screen here, and I'll share another screen. And if Sonia, if you wouldn't mind monitoring the chat, because I'm not going to share the Miro, just because I've had like some kind of access issues with it right now. But 1 second here, I'll open the screen and I'll show you in 2 seconds.
So we're going to start with the first recommendation, which reflects some of the recommendations in the studies, which was what we've framed as develop quotas for female leaders, particularly in veterinary education. So encouraging, women to access posts of responsibility, whether it be deans or senior lecturers or program coordinators, etc. So we'd like to, this is our goal. We want to develop quotas for leadership. So what are the preconditions for such a recommendation to be viable? And this is where we'd like to invite Neil. I'm really sorry you're leaving, but I'd love that if you could provide one comment before you go, since this is quite close to the research you've been doing. So feel free before you head out. So what are some of the preconditions that would make these quotas viable, in your opinion? So feel free to just brainstorm in the chat, and we'll post them up there. Do you just one day wake up and tell everybody, okay, there are quotas. 50% of all women lecturers have to be women. I'm just going to recruit people on the street.
That's a great question.
Sorry?
Oh, did you want me to respond audibly, or did you want me to respond in the chat?
Go ahead audibly.
I mean, I would imagine creating a common culture that understands the importance of gender equity is probably a pretty important precondition. That itself is going to have that itself is quite a tough nut to crack. And it involves a ton of other educational, some socioeconomic facets that would be going into that as well. But that would be probably one of the main sort of like contributing streams, if you will, into that sort of implementation.
Great, thank you very much. So feel free, everybody, to continue writing your ideas in the chat or to put up your hand. If we don't see you and no one else is talking, you can just open your mic. So Tiana, we have foster a culture of gender equity, gender is a key indicator for application processes and screening. Mm-hmm. So we've got a question about what kind of quotas. So are we talking about parity? Are we talking about, a specific number or proportion? We're talking about engaging with ministries of education to develop standards and recommendations on staffing. Freya, would you like to comment more?
Sure, yeah. I think before we can actually reach some kind of equality, we need to push for more than just 50. Yeah, just 50-50, then that's just too easy to fall below. Then people will accept, oh, 45 is already almost 50, so that's good enough. No, we really need to push for more.
So imagine we're talking about a lot of Europe, some of Asia, some of the Americas, where women, where students in the veterinary world are about, up to 70 to 80%. So then what would you say in those cases?
Where do they end up? Because that's really great that the students are, I see the same in my own discipline. There are more women students, but do they also end up in the same powerful positions? It seems they drop off afterwards very, very quickly. So we really need to look at the entire ecosystem. And see how we can foster better networks, how we can ensure that the systems are in place that allows them to also, go through two different positions. And for that, the whole system needs to change. So radical change.
Yeah.
Okay, thank you. Okay, and then the dangers of not setting things up properly. So, just landing this new policy without being prepared could lead to a lot of negative outcomes. So I think that's a good time for us to maybe move on to possible implications. I'm just going to have a quick look. Tiana, maybe you can monitor for a minute. I'm looking at one other comment.
Oh, sure. Right. So we're talking about, sometimes those requirements will also have consequences and implications when we talk about quotas. They could be, usually there's that sort of sense of that consequences are somehow negative or implications are somehow negative. That doesn't have to be the case. We can sort of look at the other side of things. What would be the consequences and implications of having quotas? What you were just talking about, Freja, was just like, why stop kind of thing. Like there might be something behind all that we need to continue to dig into. Sorry, there's lots of little comments coming up in the chat, so I'm not sure if we've gotten, change metaphors. That could also be a requirement. That could also be a consequence of what we need to do as well. But
so we had a comment about if you don't prepare adequately, then it could lead to problems. So maybe we could explore that, Zoe or others, if you'd like to brainstorm a little bit. So what kind of problems? One of the challenges. So Tiana, maybe this could go in the consequences would be having a lot of the workforce out on maternity.
Okay.
If we have too high a proportion of workforce, according to the current paradigms, then if you've got 60% women and, a lot of them are off on maternity leave.
Yeah, Flavia, I think that's a good one too, on a requirement kind of thing. Like, how do we set the enabling environment on, a wider discussion around diversity, representation, like actually bringing people we're talking about into the room with us as well. So I think that's an important requirement.
Well, there are jobs where it's illegal to have children, like domestic workers in Singapore are not allowed to. As far as I'm aware, at least from a few years ago. So that could be one way. All right, consequence, resentment amongst men because they perceive their positions are being taken by women. Yep. So maybe this is sort of some of the implications. Maybe we could, I think maybe we moved a bit quickly because I think people are still quite interested in looking at the preconditions, but one comment here might come under both, which is to have, in conversations about diversity and about the value of a more diverse workforce. and maybe to go beyond the idea of only women, but of diversity more widely. And then we have a comment about equal pay and pay enhanced models. So pay that might cover care work and other responsibilities as well.
Right. So that's implications. Yeah, exactly. There's implications on, yeah, I would think so, considering the gender salary gap.
And so that might be, we might be talking about larger financial systems, tax systems, redistribution of wealth, basically, beyond just vet service employment.
Maybe we might have an entirely new economy as a result. A caring economy.
Well, so does that, for the group, does that, if we're talking about a caring economy, does that make you think of other consequences of having more women in leadership? So we've been talking maybe very much about structural and organizational elements. Can you think of other implications in terms of how it might impact the curricula, the types of things that are being taught, the way that veterinary science is being taught? Do you have any thoughts on that as a group?
The part of relying a lot on the care work on women, I think that is becoming a serious problem, not just in animal welfare, but also like climate change and all of that. The weight of the responsibility of women, of caring, the part of caring.
So more focus on caring. And then, so animal care, that expression in itself is a nice one. Maybe we could put that up as a sort of, slogan or something, Tiana. So we have linked to that a little bit, is less focus on medication and more on improving ecosystems, more holistic approach.
Oh, okay. I'm going to make that a connection to this one, sort of like you're unpacking another implication of a caring, a caring environment. So that could actually change, veterinary practice in general.
Well, we've got other comments like making veterinary services more accessible to a broader group of clientele and of livestock keepers and farmers.
Oops. My fingers are faster than my mouse, so apologies for the spelling mistakes.
Okay, so we had, less focus on medication, more on ecosystems, more access, broader access to vet services, the more empathetic environments.
Yep.
And more focus on animal rights.
Oops.
I don't know if there is a term for this, but it's more like this deceive of like restaurants, for example, like Chipotle, that they say that they are organic and that they take care of the animals, but at the end they are very aggressive. So like animal washing, I don't know how to say it, like animal welfare washing. That could be an implication or a consequence for.
Yeah, you add more, a sort of a caring, or like the more women, there might be that idea behind it as well. It's sort of like, maybe it's gender washing. I don't know.
Yes. it could be both, isn't it? Like gender, but also animal washing. Like
Yeah.
we're pet friendly, like this part of we're pet friendly, but it's not really pet friendly because then it's like a very crowded place and not a condition for animals, or very loud, or this type of things where there is not a specific condition for animals. I mean, I'm talking about pets right now, but it could also be part of the part of the research that you're using.
Yeah. So it's like yeah, using, I guess in some ways, well, I'm going back to the gender piece, but using gender equality like as a marketing tool or something like that, and
Yeah.
then those will have implications.
Yeah.
Okay, and then maybe should we move on? We can maybe just have a couple more comments brought in here.
Sure.
I think we've got the comment planetary rights, and also rural and access for indigenous and rural communities. So maybe we could add that in as well.
Yep.
So I might not have cited every single comment, but hopefully I'm trying to draw out the main themes that all of you have written in there.
And I think we have access to this chat as well, I imagine.
Yeah.
Get it.
Yes. Yes. Everything is being recorded, including the chat.
Okay. I think in some ways this kind of like helps us really, also your adding into this helps us really think about these recommendations differently as well, which is exactly what we were hoping.
So should we maybe play around with one more,
Sure.
and then we'll have a bit of time to reflect on what we've, what the experience has taught us. So we might spend a bit less time on the next one.
Okay.
So thanks, everyone.
Oh, sorry. Again, my driving skills look like they're in slow motion. So one moment.
So the next piece links to some of the comments we'd started earlier, so maybe these will be linked changes, is designing veterinary services for women users. So, which is kind of a different approach to saying, oh, well, we've got our vet services, now how do we adapt them to the people we didn't really think about, including women? But here we're saying, let's really design the way we provide services for women users. And I'll bring in also the concept of public good here. So World Organization for Animal Health describes its work as covering everything that's a public good. So preventing, just like vaccination for humans is considered a public good because it creates herd immunity, so is vaccinating animals. So there's a strong concept of public good. I don't know if Tiana, you wanted to add to that, but essentially what we'd like to explore here is, in order to be able to start designing vet services for women, and we're talking about for women who might manage, not necessarily own, but might manage or take care of livestock, poultry, chickens, ducks, and so on. And also food safety, because veterinary services also cover foods of animal origin. So the safety of meat and milk products, for example. Tiana, did you want to add anything to the framing of that?
No, that's really bang on, Sonia. I was just looking at a comment in the chat from Kadori, was saying it's interesting to me to see that there is the idea of having quotas for female leadership positions, when at the same time some of the German veterinarians suggest having quotas for male vets. And actually that could even be one of the consequences, right? We throw ourselves, completely off balance in some ways, keeping in mind that some of those recommendations are very much around context. You have to contextualize it where we are, but over time, certainly that could really happen, especially given the current conditions that we're in today.
And maybe that would be another step of exploration, is imagining
Yeah.
a scenario where the workforce is almost entirely women, and what the implications of that might be.
Exactly.
Yeah.
just in terms of designing veterinary services for women users, you know, does that, you know, first off, does that make sense to people? And then two, you know, what would be the requirements, you know, for it to design veterinary services for women users? Like, what would we need to be doing?
So we've got a couple of comments to kick us off.
Oh, sorry,
One
good.
of them is to have basically a participatory approach or consultative approach. Listen to the women and ask them about their animals so that we know who they are and what their needs are. So find out what their needs are, I guess you could say. Ask them what their needs are. So conduct needs assessments, hire gender specialists to inform the way this is planned and designed. So any other comments on some of the preconditions? Yeah. Vet services for women to make gender sensitive communication approach, realize what role women play in the household or on the farm. Sorry. Who is the decision maker and who actually is working and caring for animals?
What I know, it's also like it's a very high risk for a woman veterinarian when they are like alone, probably sexual harassment and
So catering for the let's say the safety of women
Yes.
professionals or practitioners. Yeah.
Mhm. And well, now there is this discussion that it's not necessarily on humans, but also like reading about the indigenous communities, about the move beyond the human centric. Now this part of animals that that has been suffer sexual violence with animals around the world. So that it's something that is more common, especially on female species.
So in terms of designing like a veterinary service for that, is just like to recognize where the, you know, I guess
It is possible to have.
yeah, well that there's just many types of issues going on. Like
Yes.
it's not just going to be, you know, you're going to be working with a number of communities, I guess, and they have different needs. So I think let's even the community context.
What is the term? Interspecies sexual violence. That's
Okay. Context issues. Oops.
In the earlier discussion, it was proposed that a more women, female workforce might lead to more vegetarianism, less consumption of meat. And here we're talking about women who are caretakers of livestock. So I wondered if that brought up any thoughts for people. Whose livelihood depends on the consumption of meat.
Another question from Anneke. Are we talking
Lower
middle income countries or more general here, or just having returned from Timor-Leste? I'd argue that some countries just having diagnostic veterinary services in general. Yeah. I would argue that too, regardless of who's giving the service. So I guess we are like, just based on the information we're getting back, I guess we are talking about you know, countries in the more lower middle income. and where we're looking at the sort of the gender dynamics and demographics and whatnot.
Okay, so then there's a comment related to that as well. Vegetarianism might not be as appropriate for the global south, so regional differences there. Maybe we can just move to the implications. I know there were other comments. We can come back to them when we finish feeding in the mind map on some of the consequences of designing vet services for women users. So if you look at some of the preconditions, do you have any thoughts on what might happen? So this means women are more able to pay for services, more able to access them, reaching a broader audience, and therefore improved animal health. So improved animal health. What about generating more respect for women in the communities? Yeah, thanks, Carla. I was gonna ask a bit about that because Ilri's done a lot of work looking, sorry, I just lost you. Yeah, so Ilri's done a lot of work looking at the implications of different types of vet services on power dynamics as well between women and men. So what might be the social, nutritional, economic consequences? Tiana, there's also greater food safety and security.
Okay.
So you can link that to child and maternal health. Nutrition, yeah.
You're always driving me nuts today.
Improved livelihoods and nutrition.
Women, that's a new word. Women.
Okay, I think we can, there's some more coming in, but I think we can maybe pause the discussion here and just have a moment for reflection on the exercises. Maybe this one to add in because I think it's quite interesting. So a different prioritization of livestock species. So how might that, and if you think of the long run, how might that change the types of livestock and then therefore investments in veterinary products and so on that would ensue. So we could have some longer discussions on that too.
Got to run, but I just wanted to say thank you, Tiana and Sonia, for great presentation.
Thanks, Carla. I'm glad you could join.
Yep. See you next time. Ciao, ciao.
Ciao.
So yeah, so maybe if we think we have to wrap up in 4 or 5 minutes.
Yeah, we do.
So we're going to and thanks for all your comments, which are leading to a lot more reflection. So Tiana, what did this bring up for you?
Well, for me, I'm sorry, I'm not going to go back to the presentation because I think we have very limited time. But for me, well, it's great to hear other people's perspectives on this. And I really do hope that it's brought something up for you, because I think most of you are already perhaps faced with this type of thing and thinking about, okay, yes, we do have a solution, but what could that look like for us? And I so hope that even just doing something that's almost like a pen and paper exercise to look through, like, okay, what are the consequences of this? Who do I need to talk to? What might my network look like as a result? Where do I need to go? Who do I, this type of thing is important. So I hope that that has brought something out for people. But you can, also just let us know as well. we have our we had our emails on the chat or on the presentation, but maybe we can put them in the chat. Does anybody want to add anything before we close?
Yeah, whether you're from the animal health world or a different environment, it'd be interesting to hear if this brought up any sort of wider reflections for you, or areas that you'd like to explore further. And yeah, thanks, Zoe, also for your suggestion.
Yeah, that's great.
Is this the kind of thinking that you've already been doing in your areas? Feel free to open your mic if you'd like to, or put a note in the chat.
Hi, my name is Masha, and I work at the moment with GIZ, so a development cooperation company in Germany. And well, the project I'm working with, we deal with wildlife trade and consumption. So it's like animal welfare is really a small part of that, but actually not that much. I wish we would do more about this. And we just started again the discussion about gender within our community, not that much within the workforce, like the colleagues. But I really loved the discussion, so thank you very much for the webinar. And I wish we would have had more time, because yeah, there's still so much to discuss about, and it's great to explore ideas and exchange. Yeah.
Thank you, Masha. We're building our network of sort of partners, and so feel free to get in touch if it's something you'd like to discuss further. Any other comments before we close?
Over to Abril and Thais.
Yes, thank you so much, Tiana and Sonia, for this amazing session. And we hope that we can have another opportunity to have you with a more extended time. And also, well, for all of you that attended the session, you're going to receive an email from Luma, and we will appreciate if you can rate this session and leave any comments that could be useful for us and for the speakers. And we thank you very much, Sonia and Tiana, for accepting to be part of this project. And this has been amazing. Thank you very much.